Hey guys, Dr. Stoker here in Los Angeles with one of our patients who's a mom of 4 children in her late 30s. About 2 years ago, we did a tummy tuck on her. It made an enormous difference. Rachel, you can lift up her breast here. You can see underneath, very large breasts, we have a nice, flat, good-looking tummy, great-looking belly button here. Hold that up a little bit higher, please. Nicely healed incision all the way across. We did a little liposuction of the inner thighs also. It made a really big difference for her, obviously, and we're super happy. Go ahead and let go. So now we're 2 years post-op, and she's back for round 2. And guess what procedure that's going to be? A breast reduction, because although her breasts look nice and she has really beautiful skin here, they're obviously enormous and really burdensome for her. That kind of limits her activity, and especially now that her abdomen is flat, it doesn't fit the rest of her. So this is going to be quite a big breast reduction. I would say the average breast reduction is probably around 400 grams per side. I would suspect we'll probably remove close to 4 times that amount, so 400% of what the typical breast reduction would be. That's going to make a really big difference for her in diminishing the back strain, the shoulder strain that she's got. It's going to open up a world of opportunities for her in which she can wear, the activities that she can have fun with, and just comfort level at work and enjoying her overall body. So I use a special technique when we do breast reduction. That includes a medial pedicle where I preserve this fullness that a patient has up here, and in fact enhance it, because as large as her breasts are, she has very little cleavage up top here. So I'm going to take a little bit of this tissue, create a pocket underneath, and sew that in there so she's got beautiful full cleavage. And then I'm going to remove all of this extra tissue around here. We're also going to do power-assisted liposuction, sculpting out her figure, because this fullness that she's got on the sides is not a big deal right now, but when her breasts are a quarter this size, it's going to become increasingly less attractive, and I think will make it more difficult to fit into bras without getting rolls out on the side. So those are the 2 big things that we're going to do today to plan out for her, and I'm really excited to get started. Hi, Dr. Stoker here in Los Angeles with a beautiful 2-month post-op result on a mommy makeover. This case was really interesting and dramatic because of her pre-existing curves were a little bit too much, and she had very, very large, burdensome breasts. I removed 2 kilograms of breast tissue per side. That's almost 5 times as large as the average size breast reduction. And it made a tremendous amount of difference to her in her symptoms, her back and shoulder pain, as you might imagine. We also performed a tummy tuck and 360-degree power-assisted liposuction to sculpt out a nicer figure here. If we lift this up, lift up her arm, look at the incision here, you can see it's very discreet, right where her underwear is. We pulled that down for the video, but it's perfectly positioned so that nobody can see it. Her thighs are more slender, but not boyish. Obviously, we wanted to enhance her curves by removing undesirable fat and bulges so that we enhanced her desired curves as this hourglass figure. So we got her breasts up off of her abdomen. We brought her abdomen in, made it super tight and flat, lifted the pubic area up, and then slimmed her circumferentially all the way around with power-assisted liposuction, including in the thighs here. And one of the things that I think is really important when we do a procedure like this is that I encourage my patients to partner with me. You know, I worked really hard for her in the 2 stages to get a great looking improvement, and these were all things that really she had very little power to impact herself. But if she now, just through sheer happiness and what she has accomplished, is able to take it to the next level, just eating a little cleaner, exercising a little bit more, trying to really commit, make it a higher priority to have healthy habits, it can have an enormous impact. And the great news is for my patients is that's exactly what happens to the vast majority of my patients in this situation. So I am overjoyed with the progress that we've made. They're big procedures. You could have all sorts of problems potentially, but we had 0 problems, just great looking results, and I'm really happy for her. And now I'm going to pass the baton back to her to take it to the next level.